Hi guys, how are you doing? It's Elaine Bintz, certified health coach, personal trainer, and it's day 3 of our 30-day health challenge in 2022. I hope you guys are having a great year so far, and I hope we have a great week ahead of us. So today's topic for day 3 is blood pressure. So most of you know about half of Americans have diagnosed high blood pressure. So usually we know someone or we are someone who has this diagnosis, and you don't need to know all the details about what it is and the physiology, but I just want to give you like the basics of what blood pressure is. So what are the numbers? So first off, where can you get tested? First place you could go is your doctor. And again, I know I keep referring back to this, but if you have that after visit summary, so if you go to the doctor, especially here in Northwest Indiana, they'll measure your blood pressure. It's one of the things they do in the beginning of the appointment, and it has two numbers, a top number and a bottom number, and we'll go over that, but not in a ton of detail. I just want you to understand the basics of blood pressure. Other places you can go, like here in Northwest Indiana, you could go to Meijer. Usually it's by like the pharmacy. Some Walmarts have a blood pressure cuff. You sit in there and it's a chair, and then there's a cuff that wraps around your upper arm. Anywhere usually there's a pharmacy, they should have a blood pressure cuff. So what is the significance of blood pressure? So if you can imagine in your body, you have this huge network of vessels that are floating around. You have arteries and you have veins and capillaries. And what are those vessels? Well, they carry blood. So an example I'm using today is like a straw. So if you can imagine, there is a tube that runs through your body, all these different miles and miles and miles of tubes, and blood runs through these tubes. So they're flexible, they move. Your blood vessels are muscular. They have muscles that allow for blood to flow through your body, and there's a particular pressure that gets exerted on the walls of your blood vessels. So what is healthy? So first off, if you have a blood pressure of about 120 over 80 or less, that is a healthy range. Now you can have too low of a blood pressure, and that would be about 80 for the top number, the systolic, which is the contraction of the heart muscle, and or 60 as the lower number, which is the diastolic, which is the relaxation of the heart muscle. If your blood pressure is 80 over 60 or less, that is considered low blood pressure, and that actually can be a problem as well. You can have a fainting spell, you can have some sort of a vasovagal response, or if you're in shock or in a coma. So definitely you can have too low of blood pressure. But then high blood pressure, which is super common in America, is a top number of 130 or higher, and then a bottom number of 81 or greater. So what causes high blood pressure? There's a lot of causes. Those of you that know me know I'm a holistic practitioner, so I don't practice medicine. I refer people out to physicians and different medical professionals as needed. But when they work with me as a health coach, I work with them on holistic practices. So one of the things that we might talk about might be things like sodium in your diet. Having a lot of salt in your diet, if you pour salt like on a surface and you see how it attracts water, salt leads to bloating and retention. So if you imagine that vessel, if you have a lot of salt, it collects water, it increases your blood volume, which increases the pressure on your blood vessels. And the salt itself, the sodium, can irritate the blood vessels as well. Another thing that can impact your blood pressure and make it rise is stress. So some of the ways that I work with people is helping with stress management and stress reduction, and how to handle different stressors so that you don't end up having high blood pressure, or the result could be having a cardiac event, like a heart attack or a stroke. So if you have a blood vessel that is blocked that fuels the brain, that's a stroke. And then if you have a blood vessel blocked that fuels the heart, that could be a heart attack. So I know everybody out there watching, you definitely have somebody in your life who loves you very much and wants to make sure you're going to live a long, healthy life. So it's important that we have a healthy blood pressure. And if you don't know what it is, or if you haven't gotten tested in like the last 2 or 3 months, go to one of your grocery stores or go to one of your pharmacies and go ahead and get your blood pressure measured. So again, my name is Elaine Bintz, health coach, personal trainer. I hope this has been informational, and I'll see you tomorrow. Have a great day. Bye.